Hello, I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore stories of survival, hope, and inspiration. These are conversations with remarkable people whose passion and ideas contribute to a better world. Today we're talking with Penny McCaslin, leader of the North Iowa Addiction and Prevention Alliance. As a public health educator, she has the opportunity to work with coalitions throughout Northern Iowa, reaching youth and adults, collaborating with community leaders, and working, practically speaking, right on the reduction of high-risk behaviors, especially amongst youth. Penny, welcome to the show. And thank you for being here. And let's start out with you telling us a little bit about yourself.
Good morning, and thanks for having me. I'm so glad to be here. So yes, I'm Penny McCaslin, and I work for actually Cerro Gordo County Department of Public Health. I've been here over 25 years, and I have been with this coalition since about the year 2000, shortly after it began. And we started way back then as a tobacco prevention focus group. And so when the Master Settlement dollars came into play and states were funded with that for prevention, they called on they called on locals to set up coalitions, and our coalition actually started out a huge youth coalition. So, but over the years, it's changed, and the name has changed, and the way it looks and its function has changed. And so, yeah, over the years, we've been able to do a lot in our community.
What's the primary region that you work with and with all the coalitions you work with around Northern Iowa?
So, I work primarily in Cerro Gordo County. However, several of our partners, as you can imagine, they have the ability and they have uh, outlets in many of the surrounding counties. Say for example, like our hospital system, Mercy, and our community action. All of these folks, our treatment and prevention centers, Prairie Ridge. All of these folks, they operate in multiple counties surrounding Cerro Gordo. So by way of working with them, yes, we can. We are able to help them in those outer areas.
Do you have a
So.
strong rural presence then?
Um, As far as actual members, you mean, or community? Community, yes,
Communities.
a
Yeah.
lot of rural community. However, we're right here in Mason City, so it's a great hub. This is our workplace hub, business, shopping, medical. So that's another way too that we are able to reach out to communities across North Iowa, is because those folks are here. We are serving them whether they live here or not. So that's a great pleasure because, quite frankly, I don't live in Cerro Gordo County, and I'm glad to be able to do some things that will benefit these smaller communities and smaller counties.
And you get to interact with a lot of people in different places, different venues. Are you in schools? Are you at different community meetings? Do you hold various government-sponsored public health outreach and stuff like that?
Yes, we do. So myself, yeah, I've worked in schools doing tobacco education, marijuana education, some of those things. But in the last couple of years, I've kind of stepped back from that a little bit because actually, organizing the coalition has become there's so many things going on with it that really keeps me very busy along with some other activities. So I'm not in the school so much, but I love to go out and speak with different community groups and inform our councils. So one of the things I do is try to make a trek around to a few of our city councils a year, just to let them know who we are, what we're doing, that we want to be a part of your community. You're out here and about, but we haven't forgot about you. We want to work together and see how, if there's anything that we can help you with here. So, little bit of everything I try. So, yeah.
Well, I know you have a good leadership in the area. Your police chief and other people are really actively involved in some of the threats and the emerging threats, especially to children, and
Yes.
trying to keep that. And I know you do great jobs on looking at, keeping alcohol from being sold to kids and other outlet stuff. Before we go to break, what do you think are the top two or three issues in terms of prevention that are the biggest focus for you in this coming year?
Just there's so many emerging drugs that are just causing havoc. And like right now we have kratom and 7-OH and the gray lines that come between, is it legal or not legal? Who's going to enforce it? Can we enforce it? How to educate the public? That's the biggest thing. Of the risk and what we are seeing in the community, what we're seeing going in and out of the treatment center, some of the serious issues that they're causing, versus what people are seeing on the store shelves, and that assumption that if it's on the store shelf, well, isn't it okay? Does that mean it's safe and healthy? But it's not.
Well, we're going to take a short break. We come back, we're going to talk about some of those specific risks that we're facing and what you're doing to help parents and community leaders understand how to manage those risks. See you all after the break. You don't want to miss this.
This is how we do at MC22. 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 Providing you entertainment when you're bored out of your mind on our channel or the Plus and online anytime.
From the Quad Squad to the Spirit Lakes team, we bring your local action straight to your screen.
This is how we do at MC22.
There is a road laid out for me.
First night here, but Amy seems cool.
Leading down to the river. I am blind, but I need not see.
What do you think?
I know this road is there for me. If I'm really free, take me down to the river and walk.
30 years ago, the internet was barely a thing. But the beginning of everything. At MediaCom, we've been here. Every single step, stride, and slide along the way. And for as much as the internet has changed, we've changed. The speed and size of our network, the performance of our technology, the scale and power of our security. Investing in the growth of our communities, and keeping you ready for what's next. See you there.
Welcome back to Surviving Bad. We're talking about community prevention efforts and addiction prevention with Penny McCaslin from Northern Iowa, North Central Iowa. And she has the opportunity to work with people that give her sort of a pipeline to the things that parents need to know, that community leaders need to know. And I'm going to ask you now to share some of that with us.
Oh goodness, it's there's so much. It's like, where do we begin? But I just want to tell you about, like we talked about before, kratom and 7-OH is a hot topic right now. We're seeing a lot of it on store shelves, and actually we're seeing some issues with it in the community as far as folks are trying to get off of maybe one drug of addiction and trying to use kratom as they're being told, over the counter, that this could help with those withdrawal symptoms. When in the end, they're becoming very addicted and very ill due to, the kratom or 7-OH, whatever it is. Sometimes, this isn't unique necessarily with kratom. It just happens to be the hot one right now. Anyway,
and we see that people want to self-medicate.
Right.
This is a natural human desire, and companies that sell these things know this, and they prey on that, and they advertise based on that without talking about all the risks. But I mean, we've all heard people say, well, I smoke because then I don't get overweight. I don't eat too much. Or I eat because I have anxiety. Well, maybe seeing a therapist would be better than gaining 20 pounds,
Right.
I know the feeling, because I've always looked at food as medicine, and you got to be careful as you get older, especially. Well, even young kids today, I mean, they maybe don't realize the habits that they have. So if they eat to feel better and maybe a little overweight, well, then maybe if they hear about kratom, they're going to think, well, maybe this will make me feel better.
Right.
And nobody advertising it or promoting it is going to tell you how it's not going to make you feel better.
Right.
I mean, even when you watch ads on TV for pharmaceuticals, there's a ton of fine print in the bottom that you can't even read hardly, that tells you all the ways that you won't feel better. And there's usually a lot more of those than there are benefits.
Right.
That doesn't mean they're not good things because they've been fully evaluated by the FDA and by doctors and peer-to-peer discovery. None of those things you can buy in a gas station or a store or online generally have any of that. So this is a big problem. I get this. And it's hard to talk about because we don't even necessarily have the letter of the law behind us because
Right.
things change so fast. You know,
Yeah,
it's
there's a
like a
lot of
hungry predator. When they want to eat, if they can't find a rabbit, they'll eat a squirrel. So these
yes.
people find places where kids and people that are trusting, they can be predators and take advantage of them. So getting out to the community, talking to people, do you find stigma, resistance, and how do you overcome some of that?
Yeah, well, that one is really tough. So what we've done is actually we've called on different sectors in our coalition. So one, which isn't necessarily part of our coalition, but it's part of our public health department, is our food inspection folks. And so the part of this came to light as they're doing food inspections and seeing some of these products on the store shelves labeled as like a supplement. And that is where accompanied with a food license, if I get this correctly, that kratom is illegal for consumption. And so or it's not supposed to be on store shelves uh, in that type of a retail environment for consumption. So anyway, so we worked with our food inspectors here in the department and developed a letter, just an educational letter, because what we found out through this and environmental scans is that retailers don't know what they're selling, the safety of it, the legality of it, or the risks and stuff. So we send out a letter to just inform them and ask them to handle it appropriately, to get educated and that sort of thing. Another thing we did was with one of our NIAPA work groups is our harm reduction and stigma reduction work group. They've developed their own coalition, the North Iowa Harm Reduction Coalition. And so one of the things that they have done is develop kind of a network, their own social media and Facebook page that they put out information and share ideas and that sort of thing. So on that social media, the leader of that North Iowa Harm Reduction Coalition is putting out some of this information about, hey, just because it's not on, just because it's on store shelves doesn't mean it's safe. This is what we're seeing. People are, being affected by the use of this substance. So watch out, be careful. And so I think that, is a great part to that. We're also working, like I said, we do environmental scans. So that was
I have a question about that because that I know that's part of what we might call like the grunt work behind the scenes. It's hard work. Give us, before we go to break, just a brief tutorial on what an environmental scan actually is.
Well,
like what you do, you actually go to stores, you actually, look at the shelves and stuff.
Yeah. And that's what we did. And sometimes that's a little scary, but so one of my colleagues went to several of the local vape shops, is what most of them are termed, and so one of the things we were looking at is the glass and metal issue with marijuana products, basically the paraphernalia, and the rule is that is supposed to be out of view of anybody age 21 or younger entering that establishment. And so that's something that, going in just like any other convenience store, basically, but to see if there is anything out like that is in view, that is not supposed to be. Also, just kind of taking an inventory, of what is on the shelves. What are they selling? How does it relate to, we see a lot of products that look just like a candy product, let's say, right next to each other. So very, very confusing for the consumer.
Well, I want to hear more about this. We're going to take a short break. We come back, we're going to continue our conversation and learn about what's happening there with kids in our communities and what's being sold to them. See you all after the break.
Local programming at your fingertips. Access to MC22 is easier than ever before and available to all Mediacom subscribers. Go to mc22.net, log into your Mediacom account, click Watch MC22, and then browse our catalog of local programming available for you. Anywhere, anytime. mc22.net/watch.
Dear future, we haven't met yet. We don't know what you look like. But at Mediacom, we think about it every day. And we'll say this: if we keep working as hard as we have the past 3 decades, if we keep adding miles of fiber, if we keep advancing our technology, if we keep raising the bar and raising each other up, we won't just be ready for you, we'll be leading the way. Sincerely, Mediacom.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking with Penny McCaslin about the important work of public health and prevention professionals. With Penny, there's an interesting twist, though, because see, she's also a parent and a grandparent, and she doesn't expect this coming. But I know that deeply there's a powerful motivation and strength that comes from that relationship with children. And I'm not asking you to tell me who your kids are, how many you have, but I'm asking you to think about how that motivates you in your work day to day.
It definitely does. We all want a safer world for the next generation, don't we? And on the broad scape, we think of that, but then sometimes in our daily steps, we don't always see it as clearly, right? All of our decisions, we would like to think are focused on that, but they're not. Sometimes they're selfish and maybe not as healthy as as we would like them to be. But yes, and actually, I started out with this from my dad. He was diagnosed with kidney cancer when I was probably a junior in high school, and so I set out like knocking on doors, collecting money for the American Cancer Society, and so I continued to work towards that kind of idea for a lot of years. And so this work at Public Health has been nothing but a dream. I mean, I could not have asked for a better public health department to be a part of, or a community to work with, all of our stakeholders through the years. I mean, it is incredible. So hopefully, I sometimes think that, our kids, they don't really, know or might not even care what we do, but hopefully someday they can look back and see, like, for instance, the smoking rates and the tobacco or the cancer rates, how they have decreased. It's slow. We know that. But over the years, it has decreased. And so hopefully, you know what, I'd like to see that someday with some of these other substances that we are, dealing with, like alcohol. You and I, we know that alcohol is one of the biggest problems we have here in Iowa. Adult binge drinking, it's not just the kids. I mean, our numbers, and that, when you talk about the relationship of alcohol use with cancer, it's very similar to tobacco. And so anyway, yes, I hope that our kids, see the hard work that we've been doing, and hoping to make a difference in what the world might have been if there wasn't prevention folks out there advocating for.
When I was young, I tried to mind my children, not when I was young, when they were young and I was doing this. I mined my children for information. It took me a while to get them to be honest with me, because they didn't feel comfortable talking to me about risks that they were taking. And we got through it, and I learned a lot from listening to them. I also learned a lot about how to talk to other kids about it, because I started to realize where the taboos were for them and where the fear was. And it's really hard to communicate with children. I don't care what every parent thinks they can. Everybody does think they can, but we know that they're really an important audience, because prevention is so key to these problems. If we eliminate the demand, the predators will go away and find something else to do. It won't be worth their time anymore. So Tell me about the different things going on in north central Iowa with getting to schools and getting to kids and the kinds of programs that there are.
Oh, I am so excited to tell you about two of my colleagues here at Public Health, Betty and Tom, and they are developing for us youth-focused prevention curriculum. And so they're developing several different lessons surrounding, again, these topics that you and I have been talking about this morning, and working off of, they already work with some other programming, positive youth development programming through a couple different grants that we've had for several years here. So those are mostly geared towards the um, pregnancy prevention and safe, safe decision making and that sort of thing along those lines. But now we're working on putting that with substances and prevention and how that using substances affects your decision making, and can affect some of these other things that go into lifelong uh, you know, things that affect us over life, like early pregnancy, right? That child is going to be with us, or on our minds, in our hearts, for a long, long time. And um, so they are working on this whole curriculum, and what we're doing is going to schools and saying, okay, so here is all the positive youth development, and then here's youth focused, and we're giving the schools kind of a menu to where they can pick out now, rather than us so long it's been, because it's grant funded. Go in, this is our program. It takes, 6 sessions in your 8th grade class, da 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 da, right? But now we're coupling that, which is great curriculum, right? But with some, and just these are the beauty in this is that we can really relate to what's really going on right now with the culture of the kids that are going on right now, right? And approach them and provide them the information that they need. So I'm just very excited about that. That's part of our Drug-Free Communities grant program, is developing that curriculum. So we got several lessons going on there, and so we do that, and then we do the Stanford Vape Free, You and Me Vape Free curriculum in our schools. We also have, through one of our other coalition members, they do community-based support groups. So those are in middle and high school. And then Too Good for Drugs is a new program that our partners, Prairie Ridge, are putting out a lot through a lot of the schools throughout North Iowa. And I think they're getting pretty good coverage on that. It's a new program, and we're hoping to see some really good results from that.
That's excellent. Hey, I look forward to coming back here and finishing up, because we're going to ask you to share some final comments, insights, and inspiration for our guests.
Okay.
So stay tuned. We'll see you in a little bit.
Mediacom Mobile. You'll love the service and the savings. Unbeatable nationwide coverage. Unlimited data. Unbelievably affordable. Switch and save 30% or more over the top 3 mobile providers. Get unlimited mobile for just $40 per line per month. Bam! No hidden fees, no contracts. Switching is cake. Keep your phone, keep your number, everything you love, except the big bill. Mediacom Mobile. Call or shop online.
I don't remember how it started.
Go to bed.
Our back and forth. It always came back.
Dad!
You probably don't remember what you told me.
That was perfect.
But I heard every word.
Welcome back. Today on Surviving Bad, we explored the role of prevention professionals and the networks they create to help build healthy communities. Let's see what insights and inspiration Penny has to share. And Penny, you've had a great career, and you still have a great career. What are some of the lessons you've learned that you'd most want to share with parents?
Again, that's such a deep subject, especially when it comes to prevention, because it's so complex. And, our kids are so at risk, no matter how much we protect them. I guess I would just share that there are so many things coming at us, and as parents, as children, youth, the communities, it is a lot of things are coming to us that aren't always going to yield a positive benefit for our communities, our culture, overall, even our neighborhoods, but definitely our families. And so, parents, you really got to advocate out there. Watch what your kids look at, what your kids see, watch what they are watching, talk to them, but mostly stop talking and open the ears, because when you listen, you will hear more than more than you might have ever thought. And it might not be in words, but it might be in emotion. But be available. And if you don't know the answers, don't fake it. Find them, help them find them. Because you know what? There's a lot of great resources in the community. So go and look for them. Call your public health department. Go to NIAPA.org. Come to Surviving Bad. There's a lot of great resources out there. But listen first and talk. But always, of course, love on your kids. And if you can help us advocate against some of these substances that are permeating our communities, please do call us. Go to NIAPA.org. We need your help. Every community needs your help.
Thank you so much for being here. We put your contact information in the credits so people can get in touch with you. I'm sure you won't mind, because I know you love doing what you do. And thank you all for watching today. Watch MediaCom MC22 and MC22.net for all of our episodes of Surviving Bad, where we explore stories of survival, hope, and inspiration with some of America's most remarkable people. On MediaCom MC22, your local programming leader.